cover planning for Prescription Drug Abuse Awareness Month, which takes place in March. As noted, my name is Joe Greaves. I'm the Assistant Executive Director at the ACCMA and the Project Director for the East Bay Safe Prescribing Coalition, and we're very pleased to have everybody join us today for the program. Before we get started, I wanted to give a quick orientation to the webinar platform that we're using, and specifically to note that there are a number of links and documents posted on the left-hand side of your slides under the Links tab. That includes a number of examples of ways that people can help raise awareness about prescription drug abuse that are happening in our community, and certainly those are examples and samples that you're welcome to draw from. In addition, there is a chat screen on the left-hand side of your slides where you can type in any questions. You can type them at any time, and we'll be taking breaks throughout the program to answer any questions that come in. Today's program is going to cover the following four things. I'm going to briefly introduce the East Bay Safe Prescribing Coalition, and then we're going to turn to April Rivero from the National Coalition Against Prescription Drug Abuse, who's going to talk about ideas for raising awareness. And then we're also going to hear from Emma Dugas from the California Healthcare Foundation, who's going to talk about strategies for gaining media exposure. And then we have Kathleen Clannon and Dan Petticord from the Alameda County Healthcare Services Agency and Contra Costa Health Services, respectively, to give an update on what each county is planning for Prescription Drug Abuse Awareness Month. So with that, just want to acknowledge our presenters and partners today. We really appreciate all of the collaboration and support from these organizations. And also want to give a special acknowledgement to the California Healthcare Foundation, which has actually provided some grant funding to help support our coalition over the next 18 months. Briefly, and I think most people on the webinar today are aware of this, and a hat tip to Dr. Clannon and Alameda County Healthcare Services Agency, which has this information on their website. But obviously there is a problem with respect to opioids, and in our own community, we've seen a dramatic increase in opioid prescriptions, and really nationally, it's reached epidemic levels. Looking at data for Alameda County, it looks like ED visits related to opioid misuse have doubled over the last 10 years or so. And for each opioid-related death, the CDC has found that there's actually 800 people potentially misusing opioids, and it looks like there is a disparate impact on poor patients. So there certainly is a problem, and our coalition was formed in May of 2015 to try to address that problem. And really what our coalition envisions is bringing the medical community in the East Bay together with other stakeholders to try to accomplish some of these aims, to promote safe and appropriate prescribing while also ensuring that pain is adequately and safely treated, and reducing prescription drug abuse and misuse, and promoting collaboration and coordination among the local medical community. And again, we are currently supported by a CHCF grant, for which we are very appreciative. Who's part of our East Bay Coalition? It's the medical community and any organizations or individuals who are really committed to collaborating to address prescription drug abuse in our community. We really welcome all folks who are interested in collaborating with us. And there is a link in the links section to our website, which is eastbaysaferx.org, where you can go to learn more about the coalition and find a coalition enrollment form. The steering committee for the coalition is shown. It's basically organizations like the ACCMA representing physicians, hospitals, community clinics, and then the health departments from each of our two East Bay counties. Our immediate areas of focus are around implementing safe prescribing guidelines in emergency departments and urgent care facilities, focusing on implementing clinical best practices, and improving care for patients on high doses of opioids. And we have four main goals, long-term goals, and that's to reduce the quantity of opioids prescribed while also ensuring that pain is appropriately treated. Reducing the co-prescribing of opioids and benzodiazepines, reducing opioid-related deaths, and reducing opioid-related ED visits. So with that, there's my contact information as well as the web address for our coalition webpage. And again, just a plug to please, if your organization has not joined our coalition, we certainly would welcome you. You can visit our website to download a coalition enrollment form. So with that, I'm pleased to turn it over to April Rivero, who's the Executive Director of the National Coalition Against Prescription Drug Abuse, who will present some ideas for raising awareness in March. And Barb, can you remind us how to unmute telephone lines?
Yeah, I'm with you, Joe. I figured it out.
Okay, great.
Okay. Let me advance my slide. Okay, so we're good to go here. So I am the Executive Director, founder and Executive Director of the National Coalition Against Prescription Drug Abuse, and we're located in San Ramon. That's where our base is. We have a couple of other branches back east, but this is where we operate from. And I'll just quickly say that the issue of prescription drug abuse is a very personal one for myself and my family, and the reason for the formation of this organization. And it was a direct result of the loss of our 21-year-old son while he was away at college in 2009. So the organization is very highly focused on prevention and doing that through community education primarily, with some legislative action where it makes sense, and also policy change. So I want to start out with the history of this month designation, and it really was first established back in 2012 when I was happened to be working with then Senator Mark DeSaulnier out of the East Bay area. And we were actually working on cures legislation at the time, trying to find a way to fund cures. And he had a bill that I was helping to support, going to Sacramento and testifying in this and that. And I remember forming basically a work group around the October time frame of that year, 2011, and happened to mention to the senator that I really felt we needed to do something big to try to get the word out, because back in that time frame, 2011, there wasn't a lot of dialogue about this issue, and so I really felt like we needed to ramp it up. We needed to get the word out, again, around the community education avenue. And so I asked him if he would be willing to, get some kind of a proclamation from our legislators at the state level, and he readily accepted that challenge, and we got that for 2012, but it was only for that year and only for the month of March that year. So towards the end of the year, I met with him to really discuss, some potential legislative action that I thought could also help the cause. And I mentioned at that time that, rather than doing this every single year, just going after this proclamation on an annual basis, it would be really helpful if we could somehow establish it as a permanent designation. So out of that discussion came the Senate Concurrent Resolution 8, SCR 8. It was passed and basically put into law on 5/9/13. That being said, that March 2013, we went ahead and just pretended it was already in place and did our thing anyway. But from that point on, it has been permanently designated. But I don't think that it was widely understood or known about. It's starting to filter out there. So I want to thank Joe and, this body for giving us an opportunity to really get everybody on board. That's what this was meant to be, a statewide effort, every county ideally coming to the table to look at their counties and decide what can be done in their own unique environments to make a difference during that month. In particular, we work on this year-round, but in the month of March really make it a bigger effort. So moving over to our next slide, I wanted to just share with you some of the things that we've done or some of the things we've thought about doing and would do potentially in the future, but just to get your thoughts around what kinds of things each one of our counties can really be working on to call attention to this problem. So I thought I would categorize it by the audience per se. So in terms of youth, it really, really helps to get youth engaged, and we do that as much as we possibly can. So one of the things that we've found really works well, and they really enjoy getting around, particularly the leadership clubs on campus, or maybe Kiwanis, or the Key clubs or Interact clubs. Any youth organization or club on campus that's really focused on community service, or say the teen councils, we engage them where we can to get on their campuses and basically do whatever awareness campaign they would like to do. And we provide them resources and support and counsel in doing that. So ideally it'd be done on every high school campus, and even down to the middle school level we can get engaged. And, of course, that's a big challenge, and that hasn't happened yet in our county, which is Contra Costa, just to be sure you know that. But we've made some really good headway, especially in the communities that I live in, because I'm out there plugging it constantly. And then actually getting into the classroom setting. So middle school, ideally, because we know the problem often starts at that level. But particularly in the high school classrooms, I am out there a lot personally in the 9th grade health classes. And what I would say is I do have a presentation. And, Joe, I'm sorry, I should have actually made that probably available, and I can do that after the call. But basically it's Prescription Drug Abuse 101. And I typically will do this in a health class setting. Sometimes the gym classes actually have the health component within them. But I'm out there, and it's a basically 45-minute to an hour presentation, and it really helps educate the kids on really how dangerous these medications can be. We cover the opioids, the stimulants, and the sedatives in that setting. And otherwise, we can also do that in an assembly fashion where all the school students come, and so you're not just hitting the 9th graders. We also have in our area, we've just started a new initiative that I'm hoping will take off in other areas, and that would be a student-athlete education campaign. So this is something that could be, at least if you can't do it during March, start thinking about it, get the right people together within your community, and perhaps start to figure out how this could work. So we know student-athletes can be at especially high risk for opioid addiction as they get treated for sports injuries. And so we are targeting the athletic directors, the coaches, ultimately working the information down to the students and their parents within the San Ramon Valley in Contra Costa County. And we are now discussing doing that same thing in the La Miranda environment. And so what that would look like is basically just short presentations, because you're basically taking up some of their coaching time or whatever. Anyway, that's something that we can help with and kind of talk with you offline about if you're interested in exploring that with us. Also, the opportunity is there. We have a lot of students that are not just playing within the school setting, the sports activities. They are playing in the club sports environment. And typically, that's even more competitive, we've found. My own son played soccer at a very high-performing level until he moved over to football. And so injuries are very, very pronounced there. And again, the whole opioid addiction issue is certainly a possibility. So, finding those club sports within your communities and asking if you can just have a little bit of their time to just present the basic information, push back on opioids wherever possible, and just ask the right questions and make sure you're treated appropriately, and you watch the meds and make sure that they don't continue them too long. Just simple things like that. The Boy Scouts of America have just implemented a new patch program, and this is really cool. It's called the Scout Strong Be MedWise patch program. And one of the things we're looking at is actually connecting with the Boy Scouts program. They do have all the kids have to do to get this patch is to go online and review a particular program that's been put together for them. But our thought is that we can get out there and supplement that program with a few more pointers, again, kind of around the opioid, situation. So if you have Boy Scouts, and everybody does, see what we can do there. And, of course, the Girl Scouts, too. They don't have a patch yet that I'm aware of. But with the Boy Scouts, they actually do, and they're really focusing on this, so we can help them do that. Another thing that we've done every single year, and this is out of my own organization, is we've created either a video contest or a poster contest. And then in some cases, I think it would be possible also to do a writing contest. But we haven't done that, but it's certainly possible. So we actually have a Contra Costa County-wide poster contest going on right now. Because La Miranda, we're just kind of waking those communities up to the fact that there is a prescription drug problem in their backyard, too, just like everywhere else. We're actually having one just for that territory, and then we're doing some stuff back east for my organization. So that would be something that may be a little tough to plan at this point, but think about it for future, because you need to give enough lead time in the the deadline to get the stuff in for you. So it may be a little tough right now, but future I would hope you'd consider that, because it does engage students, and you can have an event as we're going to have to actually give the the prizes out, and that allows you to create a community event that attracts parents and the youth that are going to be potentially awarded their prize. We also like to use our youth groups or other opportunities within the church community, the faith-based community, to give presentations, and we do actually have one set up for St. Perpetua Church over in excuse me, I have a cold. I'm sorry, in Lafayette, and that date is 2/29. So if anybody's over in that area and wants to attend, we can get. I've attached a flyer for that. But we find that it's sometimes easier to get into the faith-based environment, and many of the churches are really coming on board. They understand the problem because often they are in a position to counsel families about, the addiction problems they're having or whatever. And we've had a lot of great support with the Methodist Church in San Ramon Valley. The St. Perpetua's is a Catholic church, and so they do feel a compelling need to help with this issue, and you may be able to engage them well. And then just a basic social media campaign that's targeting youth and, of course, parents, too. Every single one of our MEDS coalitions that we lead in either the county or the municipality settings, and we have a few of them in Contra Costa County, we have Facebooks, and we post things there as frequently as we can, and just going on and setting up Google alerts so you're alerted to the news out there, and then getting that information out on a routine basis, but during the month of March, actually posting special things around this issue, I think will be something that I'm hoping Emma will be covering here in a little bit. So we can learn more about that from her. Okay, so then moving over to the parents' environment, we have parent ed presentations, and we schedule those within a school or a church setting. And we found a new resource that you may consider also. We have actually scheduled a presentation, and we know that it'll be mostly parents, if not all parents, coming at Sports Basement. So they actually have meeting rooms, and they were very kind to almost immediately respond to my request for meeting space and for their support in allowing us to do a presentation there. So we've got an hour and a half of time, and we're going to do our thing over there in Walnut Creek in this case. And we'll look at other opportunities and other sports basements in the Contra Costa County area. And then using the PTA is really critical. We do this a lot, both at the local level and at the regional level. They have willingly put in newsletter articles, and these typically go out to all the PTA parent members in an electronic environment, so that the information goes out quickly, and it's something that you can link to articles or flyers or registration sites, whatever. So we provide them with blurbs and with article information that they use, and they've been really good. And then also to use the parent groups to give presentations, to alert the parents in that setting so that you can schedule typically time with them during their normal meetings to do that, and we've done that a lot. And then school district newsletters, actually using your school districts to get, again, kind of the same articles, that you're providing to the PTA, but provide them to the school district because not everybody is a PTA member, and yet the school district typically these days have an electronic newsletter that does go out to everybody that's in the school district, and hopefully they read it, and we have evidence that they do and often come to our events because of that, and otherwise just providing information like safe medicine management. There is a program that the CDC developed called Up and Away. So I've also, at the end you'll see that there's a website that you can go to, but you can actually print down flyers and such that will alert parents to the need to lock up their medications and properly dispose of them. We're also looking at connecting with the elementary and even the preschool environments to get these materials out to them that are up and away. So it's talking about, again, that locking up and disposing thing. But where you have elementary schools that have on-site care for kids, the students, before and after school, and we do here in San Ramon Valley, we are connecting with them. They are very eager to take these materials and get them out to the parents. That include materials even for grandparents, who often are the ones that pick up these children from school. Let's see, moving over to the next slide. This would be for general adults in general. So public awareness campaign in whatever way you can do that using traditional media resources, which could include television, radio, newspaper, of course, online media. We have our patches out there. And there are other sources. I just personally filmed with CTV, Tri-Valley CTV last week, and we actually are airing right now through this week, and I think they're going to do it next week for us as well, just talking about Prescription Drug Abuse Awareness Month. It gives you an opportunity to share what you're doing in your community and get the word out in that way, too. They're almost always willing, if you get a hold of them a month or so in advance, to schedule time with you if they have programs, and as Tri-Valley does. Conducting a health fair, and again, it's kind of late in the game probably to do that, but thinking about that next year where you're really providing resources to your community that are focused on prevention, treatment, alternative treatment options that people should and can consider instead of taking these potentially deadly addictive medications. We're actually coupling that with the Dose of Awareness Walk that we're holding on 2/28 in San Ramon that we would love to see anyone in the area attend. A flyer has been provided for that as well as one of the attachments. But, in addition to the walk, we're having our health fair and providing all those wonderful community resources, not just locally but on a county-wide basis. Dan Petticord, in fact, will be speaking there at that event for us. And then jumping back over to the author and book readings, we have two wonderful authors in the Bay Area, and I'm sure others within other communities in the state have the same kind of opportunity. Deanne Burwell has written a great book called Saving Jake, and Aaron Daly, Generation RX. They're going to be at a library giving a book reading and having a conversation and signing their books. So that's been planned for us. Again, a flyer's been provided about that. And then we have been lucky enough to have a independent theater, Brendan Theater, over in Concord, provide a free screening room for us over the last few years. And so we are actually going to be showing this time around Chasing the Dragon, which is a brand new film that I'd want you to know about. The FBI has actually developed it and put it together for us, and it's wonderful. I've had several people view it. It really speaks from many different angles about the problem and also its evolution, prescription drug to heroin evolution. So that is something we are doing as well. And then one of the things you could be doing, and this could be easily done, we know that CVS has made an announcement a few months ago that they're providing naloxone behind the counter, and of course there was a ramp-up period, and we're getting towards the end of that. In some places, CVS is actually doing that. They're out there distributing naloxone from their pharmacies, but others aren't. They're kind of still in the ramp-up stages. So we've been actually doing some site visits to check to see, are you doing it? Where are you? And distributing that to let them know that we really do want that to happen and to hopefully nudge them into doing it sooner than it might have happened otherwise. So just doing a check and then pointing people that direction, again, using your media to let people know where they can get this naloxone over the counter. And then just having a general naloxone awareness campaign would be in whatever way you can do that, and again, using your media resources to get that done. The safe medicine management, again, just the general, population of adults, we want to get that word out, and that includes the seniors. So giving presentations or information flow out to our senior communities, they're often targeted by our youth in particular who go to visit the grandma, grandpa to get the meds that they are seeking. So we need them to be on alert for that. And giving workplace presentations is also a possibility. We've done that before as well. Moving over to school personnel, the school district newsletter articles, that's what we were talking about a little bit ago, but also engaging. What I've found consistently is that we have a lot of teachers and administrators and staff members working in school environments that don't yet really understand any more about the prescription drug abuse issue than the average parent does. And so we focus wherever we can on getting into, teacher education days and squirreling away some time for us to give presentations. And so we've got one in the works for the San Ramon Valley School District area that I live in. So that would be another thing. Just keep that in mind, if not this time, certainly any time, even beyond March. It helps to get our educators on board. And then using these PTA group newsletters and the presentations and for school personnel, engaging them in that way. And then moving over to the civic, county, and state leaders. These are our legislators, by and large, our civic leaders, like our council members, our mayors, et cetera. And doing what we can to get our proclamations out there. We do have a proclamation that the Contra Costa County environment is moving forward with. We're launching it literally now. and we provided a copy of that so you can take a look at it and pick and choose what you'd like to say if you want to get those out or ask for the proclamations from these various entities. They've all been willing to do it. Every time we've asked, we've been given them. And what is nice is that when they do it happens in a couple ways. You can go to a council meeting, let's say, or a board of supervisor meeting, and typically they will approve the proclamation. And then you have an opportunity to have just 2 or 3 minutes, typically, to present information to who is there within that meeting. And typically those meetings are recorded, so your comments actually go out far and wide for people who couldn't attend the meeting, but they can watch later that council meeting or that board of supervisor meeting, and they will get the information from you that way too. So just kind of encapsulating what the issue is and what's being done about it within your area. And then scheduling meetings with those leaders, I think, is really important. I do that a lot. I meet with board of supervisor individuals, mayors, whatever the case may be, and just making sure they understand the problem, particularly as it relates to their environment that they are leaders of. Moving over to law enforcement, asking them, chief of police or whoever the right person is within your local PD, to post information on their websites. Most of them, as far as I know, have them. Certainly mine do. And then for them to use their social media, and I know in San Ramon they are using social media. So they put blurbs out there all the time. And so asking them to show their support and, from their perspective, what's going on, maybe from a, crime perspective related to this issue is really helpful. And then asking them perhaps to, do something around the impaired or drug driving. So have a campaign around that and ask them to support that, again, using their media and whatever way they can communicate about that out to the public, making sure people really get it. You can be legally held responsible if you even are taking your medications as prescribed, but you happen to be impaired. And then safe medication management campaign, having them help us get the word out about safe management of medication. So many of the PDs, at least in Contra Costa County, have bins, drop-off bins in their facilities, their police stations. And so having them help, again, using their media resources to get the word out about it. And what if they just went ahead and held a take-back event at our walk? We're actually going to have the PD on hand, and they are going to do a take-back that very day of our walk. So using events that you create and have that be an extra component is good to do. And then the medication drop-off event that is scheduled by the DEA, that's on April 20th, I think it's actually April 30th this year, having them help to promote that and get people out. And because people are out there at the police stations dropping their meds off during the DEA take-back event, that gives us an opportunity to have people on site to educate people about the fact that they can do it really Monday through Friday typically at that same station, or let them know otherwise where to go. All right, so medical providers, this is, I think, my last slide, other than the resources. So medical providers, to ask them to sign up for cures. They've got to do it by July 1st anyway. That's the law. So nudging them to actually get that sign-up done, and then to actually establish a protocol for routine use of it where, they're getting ready to potentially prescribe opioids is really important. So hopefully we can help the medical community get going on that, and to actually educate their patients regarding medicine safety and any other elements of this issue. So they could have the Up and Away campaign materials that you could provide to them to have in their offices. That makes it an easy, here you go. Medication safety, travel tips, and grandparent flyers are available through the Up and Away campaign website that I mentioned earlier, and I'm going to the slide to show you. So here are the resources. So Medicine Safety Materials is Up and Away. We've got the Medicine Abuse Project, which has a plethora of information, materials, info, counsel. They even have a hotline for parents that people can communicate about. They've got PSAs that are free to use, no problem, video clips, and especially good one, Out of Reach video. It's a teen that's filmed in his teen setting, the issue, and we've used it multiple times in some of these events that we have for parents and youth, where we typically will show the film and then we have a panel discussion afterwards. We did that a lot last year. The Parents 360 RX is a very short 11-minute video that I actually worked with the partnership to develop some of my family stories there, among others in the Bay Area and beyond. But it's a very good intro film to the topic and could be considered to be used for any of the sessions that we've talked about. And then we've got the Chasing the Dragon. So here's the actual link to that documentary that I just spoke about. So here's my contact information. I welcome any contacts from anybody that wants to follow up with me on anything I presented that we've done, or to talk over anything that you have that is maybe a suggestion beyond what we know about or have done. And I guess that is it, Joe.
Great. Thank you, April. That was a really wonderful presentation, and I think you have a lot of really wonderful suggestions. We did have one question come in, and
Okay.
I just want to remind all of our participants that if you have any questions, you can go ahead and type them in the chat area on the left-hand side of your screen, and we will take them probably during the next Q&A break. The question that was asked is, for people who are interested in doing something around naloxone, how can we best obtain the nasal atomizer / needleless syringes for the patients when we're prescribing naloxone? And
for the patients when you're prescribing.
Yeah, maybe.
So is this a medical professional that's asking the question?
It is, yes. And so we can ask one of our other presenters a little later in the presentation if that's okay.
Yeah, I don't think I would have a good answer for that. We know that they can prescribe it, and pharmacies are carrying it, from what I understand, under prescription. So I don't know that there would be a big problem. So maybe I don't know exactly what they're trying to aim for here. So
we'll circle back to that question a little later in the program then.
All right.
So at this point, we're going to turn to Emma Dugas from the California Healthcare Foundation, who is going to talk about some strategies for getting some media exposure. So Emma, take it away.
Great. Thanks, Joe, and thanks to April. That was such a whirlwind and so many good ideas for how people can sponsor events and get the awareness out there in their community. For those of you who don't know, I'm going to give you a 2-second intro to California Healthcare Foundation. We are a nonprofit philanthropy. We're based in Oakland, California, and we fund pilots and projects aimed at improving healthcare for all Californians. And about a year ago, we began a portfolio of work that seeks to end the opioid crisis in California. And so there's many projects underneath that body of work, but one of them is where we are funding 16 opioid safety coalitions that cover 24 counties in California. And we are doing this through a peer learning network, and we're actually making parts of that network available to the public. We're hosting webinars like this one and conference calls and other technical assistance. So if you want to partake in the public portion of that, contact Joe, and he can get you in touch with me, and then we can get you hooked into that network. But now shifting gears more to the point of what I'm here to talk about today is we want to talk about strategies for gaining media exposure, specifically related to Prescription Drug Abuse Awareness Month. And Joe asked me to dive a little deeper into 2 particular kinds of media. There is a lot of different kinds of media, but we're going to be talking about op-eds and letters to the editor. You may have a social media presence. If that's something you want to explore, I'm happy to offer my thoughts offline, and you can obviously pitch to journalists and try and get a journalist-written story, but those aren't the things we're going to be talking about today. We're really going to focus on op-eds and letters to the editor. So what you have to begin with in any effort, right, and communications is no different, is you really have to understand what your goal is. So when I thought about how I might write a piece that recognizes March as Prescription Drug Abuse Awareness Month, I thought, what might my goals be in drafting an article or drafting a commentary? So here's a few. One, you might want to seek to educate or inform readers. So with this goal, you are looking to raise awareness about the problem in your community. And what you're trying to do is address either misinformation or an information vacuum. You're trying to fill it so that people know that this even is a problem locally. Another goal might be that you want to change culture or change public opinion. And this goal is a lot less about filling an information vacuum or correcting misinformation. Instead, it's really about getting to the heart of our beliefs and our biases and our prejudices and our perceptions as a society. So this is certainly a lofty goal. It can't be accomplished in one newsletter or one commentary, but it is something that is often something that is the core of communication campaigns, and you'll know that because we often see public opinion polls, and those are actually the measurement tool against whether or not the communications campaign to change public opinion is working. So just that's like kind of an insider tip. Another goal that you may have is to change practice. And even further still, you may want to change policy. So great. Those are some goals. Hopefully you see yourself in one of these. Maybe there's another goal you have for why you would want to write a commentary piece as part of March. This is not an exhaustive list, but I just think this is a good way to get us started. And what can we do now to take these goals, which in and of themselves really aren't that interesting or compelling, and turn them into something that's newsworthy? Well, the next slide tells you how, and that is you have to have your perspective within that goal. So let's find what the perspective might be if you want to educate or inform. So this is an example that I actually saw. This is the headline from an op-ed that was penned by Dr. Matt Willis, and he is with Safe Marin. And his headline was, "Abuse of Prescription Drugs is a Marin Problem." And so what he was trying to do with that headline, and then certainly throughout the piece, is he's trying to inform and educate that the problem exists in his own backyard. Marin is not unique. The problem is there in that community, and they are struggling with it, and this is the way that they're working to try to address it. So that was a great op-ed, and you can actually look that up. It's on the web, and you can search for it by that title. All right, so if your goal is to change culture or public opinion, I thought about what is the perspective, what's one perspective you might have within that goal. And I saw this headline, and it says, "Patients with addiction need treatment, not stigma." So I really encourage you to think about what the bias kind of assumptions, maybe myths in your community are. I often ask myself, who is the scapegoat? You know, who's being underrepresented in the dialogue, and who's maybe being seen as the source of the problem, and maybe that's unfair, and maybe that provides a place for you to think about your perspective and think about your goal, and then write on that topic. All right, another goal you might have is to change practice. And the perspective example that I have that's coupled with this is this great quote that I found, and it said, "Don't prescribe 30 when 3 will do." And I believe, if my memory serves, this was a dentist talking about a prescription opioid. So I really liked here is that he's using his perspective to talk about changing the practice of over-prescribing. And another one that I thought of that I thought could be really interesting is maybe you have a perspective to offer about a better way or an alternative to how drug-related crimes are currently tried in drug courts. Or maybe you have another perspective or alternative to champion against what a current practice may be that you feel has gone astray or was never right to begin with. Those are the places where you're going to find your perspective, and that's going to give you the desire and really the strength to write a good commentary piece. And then finally, I have policy. And I think it's really easy to think that policy only happens in Sacramento, but really policy is actually a lot of different things. So one policy perspective headline that I saw was an NPR story, and the headline was, "When Rehab Might Help, but Insurance Won't Cover It." And so here the writer is talking about a reimbursement policy. So I hope this is all making sense about your goal and then pairing your goal really with your perspective. But I do want to admit that there's a little irony in my presentation so far, and that is that this probably feels really innate to you. This is not something you have to have a methodological approach to, because if you have the credentials to be able to opine on this topic, and a newspaper is going to accept your commentary based on your level of expertise or your area of background, then you probably have more than one perspective. You probably have a dozen perspectives that you want to see in print. You have a lot of things that you want to get out there and you want to say and contribute to the public dialogue. So use this as a push in the right direction. Use this as a way to get over any fear or unfamiliarity with writing for a newspaper, but also go with your gut and go with the perspective that you have naturally about this topic, because I'm sure you're all very passionate about it. And then the last thing I just want to point out is, with your commentary piece, what you're really trying to do is inspire action. So you want to make sure that you are signaling to the reader of your op-ed or your letter to the editor what they can do, the role that they can play, the voice that they can lend to the chorus, the action they may take. And so if you've done your piece correctly and you've been able to educate and maybe motivate them, then that last paragraph or that last sentence is giving the reader an opportunity to have a role in the change. All right, so let's go on. We talked about goal and perspective, and now we're going to break it down a little bit further, and we're going to talk about the elements that you can use when you are drafting a commentary. And you can think of this as an exercise in outlining a piece. So I'm going to just go through them and build the whole slide, and then I'm going to walk through each one. So first, when you're writing persuasive prose, you want to think about what is the data. You want to give people the facts. And one of the things I actually say, and when I'm writing sometimes, is I will say, the fact is X, Y, and Z. Because it's actually really important that we signal to readers that we are telling them the facts, and then you use the data to back up your facts. One thing to remember about data is that you don't want to use too many numbers. You don't want to overwhelm people. You want to keep the data really easy to understand. I would only use maybe 2 or 3 data elements. Local data is always better. And your data should be memorable. So try and think of something that maybe is surprising, or use social math, or something that makes it stand out. Next, you want to use a human or societal toll. You want to talk about what is the human impact or the societal impact of the problem that you've set up in the prior sentence or paragraph. And here I will tell you, I often see patients are recruited to be the human face of a medical or healthcare problem, and that makes a lot of sense, but I want to encourage you to actually find your own humanity as an author, and you can talk about your experience, how you've been affected by this problem, because we all have been. And I will just tell you, too, as an expert in communications, this is not seen as self-promotional. This, raising your own experience, telling your own story is actually really humbling, and readers respond to it really well. So don't think that you're being self-promotional. The next paragraph or sentence you want to get into quite quickly is what could be different. So you have a perspective, you want to see change. What is that change you want to see? How could we have an alternative? And then from there, very quickly, you can go into the good news. So you actually want to give people either a nod to the fact that the thing you want changed is on its way to being changed. There are people that are working on it. There is momentum. Or if that's not the case, you can paint the picture of what the potential might be if the thing you want changed could be changed. So you talk about the gains that society would experience, or how things tomorrow might look differently than they look today. And then if something is being done about it, you definitely want to call that out and make that plain to the reader. because that gives them a nice opportunity to then look into how they can contribute to that current effort that's underway. So, can they join a group? Can they vote? Can they sign a petition? Can they make an action in their home, like locking up their prescriptions? What is it that you're asking them to do? So I hope this is all making sense. I know I'm going through this really quickly, but I want to make sure the other speakers have time as well. And so I'm just going to show you, but not really get into too much detail here. This is a template letter to the editor. If you haven't written a letter to the editor, they are usually in response to a news article, and you want to try and submit them either the same day or the day after the news article you're responding to is published. Often, letters to the editors are a critique of a news story that was published, but I've also seen them, and I've loved reading ones that say, we applaud the news story of yesterday because it hit on these high points, and we want to congratulate the reporter for covering this issue. These are other things that are going on in the community that you may not have known about, and then that way you're able to piggyback on a story and keep it in a positive frame. So those are just some tips. You want to keep these really short. You want to think about maybe even as little as 200 words, maybe 300 words. And then if you're going to do an op-ed, I just want to reiterate that editors are really looking for honest statements of opinion. They want fresh facts, and they want a creative angle. So here you're trying to tap into your passion and your perspective, and you are allowed to be persuasive in this piece. You are allowed to be partisan. You are allowed to have an opinion. And so I just want to encourage that. This is an email that you could copy. You could actually say, dear editor, our coalition is interested in getting the word out about this. I've attached an op-ed that we would love for you to consider running in March in connection with Prescription Drug Abuse Awareness Month. And then the last slide, these are just some final tips. Look up the editorial policies for each of the outlets that you want to submit to. There are word count restrictions, and there may be restrictions on how many commentaries they accept from a single individual, because they want to give voice to lots of folks in the community. You want to make sure you avoid jargon in your written piece, because you are speaking to anyone who could pick up the newspaper or who reads the newspaper online. And I will just say, if this sounds like an exercise as a low-hanging fruit, the op-ed and the letter to the editor sections of a newspaper are actually some of the highest read sections. So don't think that this is, a kind of historical or outdated mode of getting your word out there. This is actually something that is still captures a lot of attention and a lot of eyeballs. And then you want to make sure that you're offering a specific recommendation in your piece, and you want to follow up with the editor. I've also seen the reason that op-eds and letters to the editor can be quite successful is they're a nice first effort for getting you comfortable with working with the media. Once you can really succinctly point out what you want to change, and they know you have a perspective, and you've been able to establish a relationship with that outlet and with that editor, then you can revisit them again and see if they could, you could pitch them on a story, and you could have a journalist cover your next event or your next piece of news, and you've started to build that relationship. So those are my tips. That was a whirlwind, but I want to make sure that other speakers have some time now.
Great. Thank you, Emma. That was really terrific. I know you didn't have a lot of time, but that was packed with good information, so thank you. Next up, we're going to hear from Dr. Kathleen Clannon, who is the Medical Director for the Alameda County Healthcare Services Agency, and she's going to give an update on what the county's plan. And I was remiss earlier in acknowledging that she's actually the co-chair, one of the co-chairs of our East Bay Safe Prescribing Coalition. So welcome, Dr. Clannon, and I'll go ahead and advance the slides. Just let me know when you're ready to go to the next slide.
Okay, thanks, Joe. It was great, actually, to hear both from April and from Emma. I get new ideas every time I hear from either of you, so thanks. So in Alameda County, we are stealing shamelessly from last year's Contra Costa County efforts. And many of the things that we are planning for the month of March actually are things that are either also happening in Contra Costa or happened there last year. Our overall goal for March is really public awareness, although we also have some efforts that are directed to the prescriber community. Our first goal is to begin the process of bending the demand curve, and what we mean by that is that general public will have some more recognition of more respect for the potential dangers of these drugs, and that they can kind of meet with their doctors with the expectation that it might be a good thing for them to be on less medication or not use them at all. So bending the demand curve is one. And then because we have a big focus on drug disposal in our county, then safe disposal and safe storage. So those are the things we're kind of focused on in March. You can see here in the slide the list of some of the activities that we're doing. Our public health officer, Dr. Davis, is going to release this public health advisory, and we are going to be releasing that and also the proclamation from the Board of Supervisors, very similar to the one that April has posted. Those two things are going to both come out at a press conference that we're going to do on March 1st. It's kind of setting the stage for the month. And those just we're hoping that will be a hook that will get some attention from the press. We also are at that activity, we're going to try to have either a real or a mock disposal site, so that both for the visuals and also to really encourage people who have the medications to participate in improving the safety in their own community. You can see there that we've been putting together a fact sheet that we're hoping to spread around to as many people as will take it from us. And this is part of our effort to improve data on this issue throughout Alameda County. Let's go ahead to the next slide, Joe. Joe?
I advanced it.
Oh, it's probably just it's not picking up on where I am. So our other activities, we are supporting improvements in the ability for people to get both non-opioid assists with their pain, and also help getting off opioids if they want to do that, and if it makes sense for their health. And that is a very important part of that is expanded buprenorphine availability. Buprenorphine is a safer opioid, still an opioid, but it's a safer one in terms of overdose and has less value to people who are looking to divert them. We are pushing on the naloxone issue. Saw the question that Dr. Boley asked, and I don't actually know the answer. I know that the FDA has now approved nasal naloxone, so that will make it more available, but I'm not sure whether Medi-Cal has put the nasal delivery mechanism on their formularies yet. And for many of us, that's really the issue, is being able to pay for it. But we have a county-supported naloxone program, and we're going to be talking about that, expanding it into the south part of our county in this coming year. So we're trying to hit here on multiple different audiences and parts of the issue, and hoping to have some new activity or event at least once a week during the month in order to kind of keep the momentum going. And that's what we have plans for. I want to turn it back over to Joe so we can hear from Dr. Petticord.
Wonderful. Thanks, Dr. Clannon. Dan, you want to add what Contra Costa is planning?
Sure. Can folks hear me?
I believe so.
Can you hear me?
Yes.
Okay, so maybe that's a little better. What we're doing here in Contra Costa, I think, is very close and parallel to what Dr. Clannon outlined for Alameda County. We'll do a public health advisory, and we've actually been working with Kathleen and Muntu Davis in Alameda on sort of, how those will look county to county. April, of course, has taken the lead for us on getting a resolution to the Board of Supervisors and also having a number of cities adopt resolutions, which is not at all insignificant, and thank you, April, for that heavy lift. In addition to that, we'll be working with all of you to continue to expand, getting the word out about the new safe prescribing guidelines. And then on top of that, we have our epidemiology team working with April on what we're going to call a report card that will dive into the prevalence of this issue, and we're looking to continually evolve that report card so that we capture things that are not just in the health arena, but also in the corrections arena, in the school arena, or I should say the education sector. So that's an ongoing effort. Like Kathleen outlined, we too in Contra Costa are excited to be able to finally begin to expand medication-assisted treatment programs and have a number of our physician colleagues who are champions of that. It just so happens that our public health nursing team has some rich history of working with our ambulatory care system in building out some capacity for high needs or special needs populations such as homeless populations, dental services. So we are working in partnership with our ambulatory care system to build out the expansion of these buprenorphine clinics. Another initiative that I think parallels what Dr. Clannon was talking about, I think we're a little further behind, though, in terms of the rollout of expanded availability of naloxone. We just met this morning and thought that it would be a good idea to create a task force that's specific to that effort that would include a pharmacist from our health plan, some folks from our EMS agency, some individuals from alcohol and drug treatment therapy. So we're going to be pulling that together, but the idea there, too, is to get naloxone more available and out into school and particularly secondary school settings and potentially in law enforcement hands in areas that are more rural in the county. And we were reminding ourselves that there are sort of two pathways for the administration of naloxone. One is sort of a medical pathway where some stakeholders want to see a physician order and give that under the guidance of someone who has prescriptive privileges, and the other is through the pathway of I'm at a loss for words. April, what did we call it? April, are you still on the phone?
Yeah, I'm here. I was on mute, of course.
I'm forgetting what we called it earlier in terms of the administration of naloxone. Just at a loss for words. Well, it's essentially a Good Samaritan kind of a concept. So where in school settings and in other community settings, folks can give it under the Good Samaritan concept, and we thought that concept may help be a breakthrough idea for some folks, particularly in our EMS community, who are a little more reticent about the benefit and also what role they play in the kind of quality assurance aspects of expanded access to naloxone. Like you, we too are having our public awareness campaign part of this effort. We are fortunate that we have a small but mighty PR team that our alcohol and drug therapy director is working with to put something out. We'll probably also look to do either an article or an editorial from Dr. Walker, who is our county health officer and also health system administrator. Another component of our sort of ongoing initiative that probably will never really end is asking ourselves what data points do we think we're missing, and then bringing that under the umbrella of something we'll call a data capture initiative. And then finally, we are actually beginning to contemplate the creation of a social sobering center, and we're very fortunate that Cynthia Bellin, who is our behavioral health director, came from San Francisco and was instrumental over there in establishing their center some number of years ago. So we're just beginning to pass emails and ideas around about how to create the narrative that would compel our local partners to put some resources on the table to actually create a sobering center. I apologize I didn't have slides and that I ran through that rather quickly. Certainly can answer any questions anyone has.
Thank you. I really appreciate that. It was really informative, and I think it's great to hear that both counties are really taking the bull by the horns, as it were, and have quite a lot planned for March and beyond. So thanks very much for sharing. There was one question that came in that was pretty specific as to some data that's available. So I'll follow up with you after the webinar, Dan, and pose that question to you.
Sure, sure.
But it looks like we are actually out of time. That was a whole hour. So what I would certainly do is invite anybody, if you have questions that you didn't get a chance to ask during the webinar, to go ahead and email those to me. And my email address is on your screen. And I definitely want to thank all of our presenters, April, Emma, Dr. Clannon, and Ms. Petticord for joining us. We really appreciate you sharing your expertise. I think this webinar has really captured the spirit of what our coalition is about, which is bringing people together, trying to identify what the best practices are, and really challenging the rest of the community to rise up to that level. So thank you very much for your contributions. And thank you to everybody for joining us today. If you have not joined the East Bay Safe Prescribing Coalition and you'd like to be part of the work that we're doing, please visit our website. There is a link under the Links tab on the left-hand side of the slides, and there is an enrollment form that you can download and return to us there. So with that, thank you all again for joining us, and you may now disconnect.
Thank you.